You're watching Public Affairs. Berkowitz is my name and politics is our game. And we will be doing lots of politics this evening because we have as our guest Lauren Turelli, who's running for state rep. She is running in the 58th District. She is a Republican. She is running against Karen May, who's the 10-year Democratic incumbent in that office for state rep. Most of the district is on the North Shore. We'll talk about that as we get into the show. But, you know, if you're watching this and you're watching from, you know, on the internet where people watch us from Los Angeles and New York or Boston or downstate in Springfield or Chicago or the Northwest side, anywhere, and you're not in the 58th District, don't turn that dial because, you know, we're going to be talking of issues that are relevant to everybody, whether it's in the 58th District, downstate, upstate, because these are state legislative issues. And you say, well, if you're in another state, well, same thing. People are talking about taxes, they're talking about spending, they're talking about education reform, they're talking about pensions. So we're going to cut right to it. And our guest, Lauren Turelli, I'll say briefly, she was born in Chicago but came to the district in Lake Forest when she was about 4, has spent most of her life in that district and right in Lake Forest. Graduated undergrad degree from University of Illinois at Champaign-Urbana, spent some time abroad. She has been involved in institutional finance. She's been involved as a businesswoman, both small business and large business. More about our guest, perhaps, as we get into the show. But Lauren Turelli, what is it about this that's motivated you to run? Because, you know, Karen May's been there for 10 years. She's the incumbent. A lot of people say, you know, she must be doing something right or she wouldn't be there. She keeps winning re-election. What is it that you think that you would do differently from Karen May if you were the state rep representing the 58th District?
Well, I think first of all, it's a matter of approachability and being out there for your constituents. Our district is large. It stretches north to south, covering a very vast area with different demographics. And I believe that...
Pretty affluent, though, most of the district.
It is a pretty affluent
Lake
district.
Forest, Lake Bluff, Highland Park, Highwood, Deerfield, Glencoe, Northbrook, Bannockburn. Did I leave anything out?
I think you hit them all.
Okay. Most of those are, the majority are all of that in the district. But those are affluent areas. I mean, there are sort of pockets maybe in Highwood where there may be some low-income areas, right?
Correct.
Maybe somewhere in Highland Park. But, you know, we're talking an affluent district.
It is an affluent district, but I'm not sure that the needs of that district are always represented very well. I think that my voice would be far more independent of the Speaker of the House or the governor or whomever is in the upper levels of office.
Even if the governor were Bill Brady, because, you know, he may get elected. Right now he's leading in the polls. He's the Republican. You're a Republican. Would you be really independent of Bill Brady?
Sure. I disagree with him on his education reform. I think there are far better ways of getting people to the table to talk about issues. But I'm not so sure that, you know, if Speaker Madigan is still the Speaker, that I could be independent of him for sure.
Yeah, and if Tom Cross were the Speaker, could you be independent of him? He's currently the Republican leader in the House.
Look, I'm coming into this with no real backing other than my community. I don't have unions. I don't have big business behind me. I'm doing this as a community volunteer. I'm doing this as a small businesswoman with real solutions to some of the problems in our state. And
so independence.
Independence.
That's one thing that separates you in your mind from Karen May, right?
Absolutely.
We should say we set up the show rather late. We're taping late in the week. We're taping this show on Sunday, September 12th, and we set it up really just on Saturday. And Lauren was kind enough to respond to our request. We made a similar request to Karen May. We haven't heard back. We hoped when we found out we were going to have Lauren Turelli on that we could have Karen May join us. So we may be talking about her views, and Lauren may know something about them, I may, and we'll try to do some issue contrast. But we'd much prefer to have State Representative May here with us, and so maybe we'll be able to do that in the future. You would like it, you'd prefer if State Rep Karen May were here? I
would welcome the opportunity to have a real debate, a real forum of issues, and hammer out the differences.
And the differences, independence, in your view, that's one. Raising taxes, do you think that would be another one?
Definitely.
Yeah, I mean, you know, your view is, you know, there's a $13 billion deficit. So somebody might be skeptical if you were to say hypothetically that you don't think we should raise taxes, and you don't think that and you think we could cure the deficit without any increase in taxes? Are those your views?
Those are pretty much it. If you look at our budget and what we spend, we have a $36 billion budget. And
I mean the General Revenue Fund.
General Revenue Fund. And a majority of that goes to education and health and human services. That part can't really be carved, touched, whatnot. But there are a myriad of places where I think we will find astonishing amounts of wasteful spending. And if we go through the budget on a line-by-line system, a forensic audit as we hear touted in many places, and we go through, I think we'll find that wasteful spending.
Forensic audit, and that's something that Adam Andrzejewski was pushing when he was running
Correct.
for governor in the Republican primary. Did you steal that from Adam, or is that an independent view?
I'm borrowing it.
You're borrowing it. He gave you permission. He licensed your use?
Well, I think it's not just even Adam that talks about it. You'll see it in the Illinois Policy Institute initiatives of going line by line, seeing what's really there and forcing the accountability issue, and determining, from that forensic audit, determining or reprioritizing where those funds need to go. I think that's a necessary step before anybody starts talking about increasing taxes.
Yeah, when you said $36 billion, isn't it the General Revenue Fund? I said the General Revenue, but isn't that closer to 27 or 28 billion, or do you know exactly what it is?
Which are you speaking?
The General Revenue Fund, because you said a $36 billion budget. I think the General Revenue Fund is more in the 27 to 29 billion range, depending on what year we're talking about. It may have been higher in prior years.
I think it may have been higher.
And the total budget would be something like 55 billion, right? Which would
Correct.
include capital projects, federal funds that are spent, and so forth.
Right. But if you look at it...
So which one are we talking about? Just so
well, we're talking about the General Revenue Fund that covers education and...
Which is roughly similar to 27 to 30 billion
Correct.
Currently, right?
Mm-hmm.
Okay.
But if you look at it, the state's population has increased by 6.8% over the last 10 years. Spending has increased by 39%, which clearly tells me that we have a spending problem. It's not one taking in revenue.
That's over the last 10 years?
Over the last 10 years.
Spending's gone up by how much?
39%.
Is that adjusted for inflation, or is that part of that? That doesn't include inflation?
No, it is adjusted for inflation.
So that's a real growth in spending.
Real growth in spending.
And a lot of that's gone where?
A lot of that has gone towards Medicaid. A lot of that has gone towards education.
Okay. And so do you think you would have spent less in the last 10 years on education than the state of Illinois did?
I don't know for sure if I would have spent less. I think I perhaps would have spent it differently.
So, but that wouldn't help us in terms of the deficit if you spent it differently, right? I mean, if we still spent the same amount but spent it differently, we would still have a deficit, wouldn't we? Unless you were going to raise revenue or raise taxes, or unless you had greater economic growth. So I just want to interrupt to say, if we're asking, there's a $13 billion deficit right now.
Correct.
And as I said, they might be kind of skeptical if you say that the General Revenue Fund is in the range of $30 billion, and you're going to somehow solve this year. Say you were a state rep this year, and you had to solve it by fiscal year 2011. That's the budget we're talking about. That's the budget year that ends June 30, 2011. Okay? People say there's a $13 billion deficit. How are you going to make up that difference? You can't really talk about cutting spending by $13 billion in a $30 billion budget, right?
And you can't do it in a single year either. Look, it's
taken
us 10 years to get here.
But you have to have a balanced budget, don't you? If you don't, what do you do? So let's break it down. The operating deficit, what's the operating deficit right now? Ballpark.
I couldn't tell you. Ballpark.
Would you say $6 billion or something like that? $7 billion?
Very well could be.
Yeah, and then there's about $6 billion in unpaid bills. So yes. I think that's what people mean. So it's kind of different things, because one is your current operating deficit, the other is sort of a stock concept, I'll say, as opposed to a flow. Really confuse people that way. But it is different in the sense that if you don't do anything about the deficit, you would continue to accumulate that year by year. The $6 billion in unpaid bills, if you can figure out how to do that, that's then taken care of. And it doesn't repeat, you can just roll it over, but you don't get $6 billion of new debt each year. But okay, so say hypothetically we were going to roll over that and somehow do something with the $6 billion in unpaid bills, borrow and so forth. Not saying we should, but do you think we could address the operating deficit and at least get that down this year to a balanced budget on the operating level?
I think there are. I think there are plenty of proposals that have come out. Again, Illinois Policy Institute, Truth in Accounting, they've come up with specific plans. The problem with these specific plans is that they affect people that aren't necessarily at the table making these decisions. And I think in order for things to follow through, I think in order for things to change, reform to happen, or budget obligations to be met, you're going to have all of these people at the same table, and there's going to have to be a lot of give and take. The answer to your question is yes. I think we can figure out ways to solve these problems. It's just going to be difficult to get there.
All right, so give me a ballpark figure, some categories of how much you would cut or recommend being cut. I know you're not the governor. I know you're not the Speaker of the House or the Minority Leader, but still, you want to have input, you want to be a leader. Let's say we're trying to cut $6 billion out of this $27 to $30 billion budget. Would you cut education spending?
No.
No, you leave that alone.
I leave that alone.
Would you cut health care or Medicaid spending?
I think there's a lot of fraud in Medicaid. I think there are plenty of redundancies and inefficiencies. Since Blagojevich came in office and the eligibility requirements were raised, 1 in 5 people in the state of Illinois are on Medicaid. That's absolutely absurd. In fact, somebody was saying, I was speaking to recently, who was saying that because of the Obama health care reforms and because of what Blagojevich did to increase eligibility, we're not going to be affected as a state very much by some of these new health care reforms.
We're not going to be affected.
We're not going to be.
Because we've already done what the
We've
health care
already done
reforms
a lot
we
of
try to
what
do.
the...
In terms of expanding eligibility
Correct.
For Medicaid,
Correct.
for state-provided health care, or at least state-financed health care.
Right.
But so if you were you saying there's fraud and abuse, there are areas to save there. Ballpark, what do you think you could save in this current fiscal year? $1 billion, $2 billion?
Oh, look, I'm not an actuary, but I would think that we could get to that sort of savings.
All right. Would you do it by having managed care? Would you say that's the way?
I think managed care is a fantastic option. I think we can have greater reliance on our public health system in places like the county health offices. Utilize them as not only an administrative role, but actually delivery of services.
Okay, and then former state senator Steve Rauschenberger is running again to regain his old seat. He has talked about the reimbursement rates, in his view, are too high for hospitals. Those could be modernized or made more appropriate for actual costs. I think, if I'm getting that right, I hope I am. Would you agree? Is that an area to look at?
I think that's an area. I think one of the other problems that the average person is seeing, especially if they have a Blue Cross and Blue Shield card, since the state is the administrator of those policies, plenty of doctors in my area are no longer taking Blue Cross and Blue Shield, even as an insurance carrier. They're not getting reimbursed. It's hurting the quality of care.
So the doctor's rates may be too low for reimbursement, and the hospitals may be too high. So we have to realign.
And too slow.
And too slow. But if we're going to raise that, we're going to have to look for other areas to finance that. So there's some saving, say $1 billion or $2 billion in healthcare, just to throw out a number. You're not cutting education. Would you do anything on the pension side, which is an area of tremendous growth in state spending?
Well, the pension issue is a tremendous problem. It constitutes one of the major focal points of our fiscal crisis. How do you get public pensions in line with what the private sector pays? Private policies are nowhere near as generous as the public pension system. Part of the problem there is that people are living far longer than anyone ever expected when they initiated the pension system. We saw in the spring, we saw some early pension reforms, raising the retirement age, capping
for state employees.
For state employees.
And what was it raised from? What to what?
It was raised from 62 to 67. The salary was capped at $106,000. It's a good start.
What does that mean, capped at $106,000?
It goes into the funding formula.
That's the maximum pension that somebody could receive, or is that the maximum income
salary?
That's the maximum base on which their pension
Correct.
could be calculated.
Correct. But the problem with the pensions that we see, it starts with the fact that the current legislature, nor the previous legislative sessions, have actually funded the pensions as they're supposed to. So you have that unfunded mandate.
How much is it in terms of being unfunded, do you know?
Depends on who you ask.
I'm
Anywhere between $80 and $90 billion.
Okay. All right, so you have that problem in terms of funding it.
Correct. So you have that initial problem. So where do we go from there, knowing that we're already in a hole? Do you sell assets? Do you find other creative ways? Do you borrow short term? what do you do to get there? That's one initial conversation. When you speak of reform, it's where do we go from here? Assuming that we can find a way to cover those unfunded mandates, where do you go?
Yeah, well, where do you go?
Where do you go?
Because the reform that you spoke of for raising the minimum age for retirement, right, from 62 to 67, does that apply to current employees or future employees? People who are currently working, say, for the state of Illinois and say they're 54, have they just found out they need to work to 67 before they can retire? Or is this only applied to somebody who is hired, say, this year?
It's new employees, as I understand it.
So the savings are going to be into the future as opposed to this year?
Correct.
So some people suggest you can't do anything with the pensions that have vested for current employees, but
Correct.
The portion of the pension going forward that hasn't yet vested, they think you could change that pension plan. What do you think?
Well, it's a legal question.
It's a legal question, and a number of law firms have said yes, you can, and some law firms have
Correct.
said you can't.
And it depends on what you follow.
Is it worth a shot? Would you like to give it a shot? If you were voting and that proposal were up and you were there instead of Karen May, how would you vote?
I would not vote to take away benefits from current employees.
At all?
I think
so
we
in that
can
way,
adjust.
do you think Karen May is saying the same thing?
I'm not sure what she's saying.
Okay.
I dare speak for her.
Okay.
I know she's outlined her own 10-point pension plan.
But you don't know if it includes that?
No, I don't believe that it does.
Okay.
We may have to tinker with it at some point.
But you
down
wouldn't
the road.
do anything for current. You wouldn't take away any benefits. So really, you're not going to get any savings this year from anything you're going to do. So I'm stymied because if I'm a viewer out there, a potential voter, I hear you saying you want to cut spending, you want to rein in out of control spending, like you've said before, if not on the show. But then we got a $30 billion budget, at least or so, in general revenue fund, and so far we have a $6 billion deficit. And where are you willing to cut? Maybe Medicaid, healthcare, maybe $1 billion to $2 billion, not education, not pensions.
I want to do this the right way. I don't think, and I think that's the problem we found ourselves in. Instead of doing something and taking the entire problem and looking at it and finding those solutions, we're looking for short-term fixes. We kick the can, we borrow, we save it for another day and another generation to pay for. If we do this right, we need an actuarial commission that's going to sit down and say, here's what we can afford and here's what we can't. This is how long people are living. These are the benefits that they can get. I think there's a lot that we can do moving forward and get it right and make this a solvent situation.
But one major area where people recommend you could save costs on the pension side currently and future, certainly if you applied it to current employees, at least as to future benefits, would be to convert from a defined benefit system, which is what we currently have for the state employees, which very few private employees currently have. And most private companies have changed from a defined benefit to defined contribution 401k. So would you favor legislation that, say, at least for future employees, change the system from defined benefits to defined contributions?
I would
Future
strongly
employees.
consider it.
Strongly consider it. But you know, Arizona has really poked at politicians, not just people running for office, holding office, saying they would strongly consider, they would think about, so forth. It's kind of a dodge. And I'm not saying that, but Soren, who's a Chicago Tribune columnist, has written about Republicans and Democrats who say that. I'll strongly consider it. The voters really want to know, if you were there, what would you do? Because Karen May right now, one thing you can say, for 10 years, she's got a record. She has had to vote. And so they're saying, well, you haven't had to vote, but at least tell them how you would vote when we give you a hypothetical.
I can tell you this. I would lean in that direction. My problem with this whole pension mess is that every little peel of the onion that I pull back, I'm finding out something new. And I just don't want to go and say, oh, that's a great idea, let's go with it, and find out later it's a different cost to the taxpayers. I think there are significant savings by going towards a defined contribution model. Having worked in pensions, more companies than not have gone towards that direction. Okay. It gives more flexibility to the employees, it helps with the return on investment, and it would certainly save the state a lot of money. It sounds great, but I'm not going on record to say that that's the way to go yet.
Yeah, the unions don't want that, do they?
No, they don't.
Okay. Well, do you think that might have an impact on you? I mean, they can influence elections, right?
They can influence elections.
Have they approached you and talked about campaign contributions to you?
They have not.
Do they give money to your opponent, Karen May?
They do. If you look at the current filings in June, you'll see plenty of unions on there as donors.
Now, do you think she just happens to have those views and the unions look for somebody who has those views and they support it, or does it go vice versa?
I'm not sure how that works there.
Do you You're not going to say your opponent is being bought.
I don't think there are many politicians that are bought. I think are
they influenced?
They are strongly influenced.
So do you think there should be limits? There are limits now. We passed that last year, campaign contribution limits to individuals, candidates, right?
We did.
They're pretty high. What are they, you know?
Well,
how much can an individual give to you? I mean, you must know because you're out raising money. If they want to write a check, what's the limit?
There's actually no limit unless you're a current elected official.
So if you're current, but running right now, you have no limit? Somebody
could, no limits.
They could send, an individual could write a check to you for $15,000?
Sure. So if you'd like to, Jeff, no, I'm just kidding.
Yeah, we don't support candidates here.
I'm teasing.
All right. But actually, I'd raise a point. How do people find out about you?
Go to my website, Turelli4tomorrow.com. There are plenty of pieces of information there about what I would do, what I have done, who I am. There are plenty of opportunities to sign up for newsletters, donations, you name it, where we're going to be, the kinds of events we're having. Okay, so it's a nice website.
Turelli4, that's as we said, the number 4, so it's Turelli4tomorrow.com. When they go there, they might not find out, so there's some things left out of your background. You have been involved in institutional finance, right?
Correct.
You have been a teacher. I think that's there, but you were nominated for the Golden Apple Award, right?
Yes, you've done your research.
Taught 3 years, right?
Correct.
So switching over to education reform, would you be somebody, what would be the major areas or major recommendations you would make to reform education?
Well, you look at the reforms that have gone forward thus far. We received a ton of cash from the federal government for No Child Left Behind. I'm not sure that that's met the goals. I think when it comes to state education, we are failing miserably in some of our schools. By some estimates, you have 22,000 to 30,000 students that are not being educated.
20, oh, is that all? I mean, how many students do we have in the state of Illinois? Quite a few more than that.
Oh, quite a few more. I'm speaking of Chicago public schools at the moment.
But even there, I mean, we've got about 400,000 students in Chicago public schools. You think only 22 to 30,000 aren't being educated well? Because other people say about half, at least, are in schools that what they would call failing schools. That'll be 200,000 students.
I think that number has the potential to grow.
Okay.
But if you go by the standards of, and I really like what Senator Meeks has done with his proposals. I am pro-school choice. I think that if we leave decisions up to the families and we give them an opportunity to make the best decisions for their children, we will see an increase in our education numbers and our matriculation rates, and we'll see a reduction in our dropout rates.
So what kind of choice would you give parents?
I would give choice to the students for vouchers. I think we need to lift the cap on charter schools and expand those. It's not very popular with teachers, but as an educator, you can't give up on those kids. These are the schools where they need the education most.
But people say that would drain money from the public school system. What do you say to that?
I believe in competition. If you can allow these students to move to private schools, and granted, private schools have their limits, so they can't take everybody either. But you're going to push these schools to become more efficient. Most of the money in the state education budget goes to the Chicago public school system. Some will argue that it's drastically underfunded. That way may well be the case.
May well be the case because you think so? It's the budget. Do you know what the budget is for the Chicago public schools, roughly?
I couldn't tell you off the top of my head.
$6 billion. Do you know how many students? We said 400,000.
400,000.
We don't have a calculator here, but if you do the math, 400,000 into 6 billion, and that includes all costs, capital costs. It may be a little higher, a little lower, but not too different. You come up with $15,000 per kid per year. Right. Do you still think we're not spending enough on education in the public schools? Assuming my numbers are right?
Assuming your numbers are right. I can't tell you that for sure.
What do you spend in Lake Forest, roughly?
No, it's not far off from that. There was a recent...
Okay, so that's the point. I mean, you know, they're spending more at Lake Forest and Cheer, but even if it's 20,000, 15,000 is a pretty healthy chunk. All right, but so your point is parents should have school choice, school vouchers, that choice. Charter schools should be a choice. You want that for the Chicago public schools? Would you like it for the 58th district, that same kind of choice?
I don't think it matters in the 58th district. I think
schools
we have
are doing
excellent
well
schools.
There. Yeah.
I do.
So you're mainly talking about schools where they're not doing well.
The bottom line is this: I think we're failing students. We need to do something different than what's being done. The voucher programs have worked in Milwaukee, they've worked in Miami, they've worked in New Jersey. It's time to try it here.
In the Chicago public schools, wherever the schools are failing, wherever people would seem to need choice so they could have competition to improve the public schools as well as give people a choice to attend a private school.
I think we try it with Chicago and
And
see
Reverend
if it
Meeks
works.
is, State Senator Meeks, Reverend Meeks, he has proposed that legislation. It passed the Senate. It didn't pass the House.
Correct.
Your opponent, Karen May, how'd she vote?
She did not vote in favor of it.
In favor of school choice.
Correct.
And you know why?
I'm not sure.
Well, we'd have Karen here. We could ask her and talk about that. Maybe that'll come up. You've got a forum coming up on September 30th, right?
We do, in Lake Forest at the Sterling Hall Senior Center, 7 o'clock on the 30th.
League of Women Voters is sponsoring that.
They are.
Now, that's one forum. You would like to have multiple forums and debates with your opponent, Karen May?
I would welcome the opportunity
How many
to
do you
hammer
think
out
you
the
should
issues.
have?
As many as she would agree to.
Well, how many would you like if it was up to you? 5,
With
10?
2 months left, once a week, 8, 7.
8? Okay, so that's a challenge. Karen May, would you sign up for 8 debates? We could have one of them right here on Public Affairs. We will make our set available. You could, I wouldn't call it debate so much as a casual conversation of the issues between the incumbent, Karen May, who's a Democrat, and the opponent or challenger, Lauren Turelli, Republican, right? Casual conversation.
That would
All
be
right,
great.
let's have a casual conversation. We're going to continue to speak as the credits roll, but I very much want to thank our guest, Lauren Turelli, who's running for state rep. She's running in the 58th district. She is a Republican. She's running against the 10-year incumbent, Karen May, who's a Democrat, and that election is coming up on November 2nd, so we've got like about 53 days left.
You got
Or
it.
so. Social issues seem to often come up either on the end of my show or the end of the campaign. As Howard Dean once said, gays, guns, God, and abortion kind of sums it up. Let's go quickly. Gays, okay? Same-sex marriage, you think gays or gay rights. Would you sign on to same-sex marriage?
No.
Sign on to civil unions?
No.
No. Okay, no on either. You don't think, well, we'll come back as to why. Abortion, pro-choice, pro-life?
I do not believe in partial birth abortions. I do not believe in taxpayer use of funds. I do believe in parental notification.
Okay, and the parental notification, does that mean that the parents or legal guardians have to be advised, or could you advise a friend or an uncle or a cousin?
Parents or legal guardian.
Okay, and your opponent, Karen May, do you know her view on parental notice?
I know that she is not in favor of that.
Not as you've articulated it, and defined to legal guardians or
Correct.
parents. All right, and you're opposed to late-term or partial birth abortions?
Yes.
Your opponent, Karen May?
I believe she's in favor of
She
it.
would favor, at least she would allow them. right?
Allow them.
But if the Supreme Court were to overturn Roe v. Wade, which basically give women a right or a choice to have an abortion, at least up to the first 6 months, right?
Mm-hmm.
If they were to overturn that and so they say that it's a federal system here in the United States, and say this is not something that should be and is not constitutionally guaranteed, and we're going to allow each state to determine what their abortion policy should be. So they kick it back to the states. Let's assume you're in the state legislature. Somebody says, well, they think there should be abortions only in the case of if the life of the mother were at issue. Would you vote for that legislation?
First of all, I don't think it will be overturned.
But if it is?
Well, it's a
hypothetical, but they're allowed
question.
on this set because I set the rules. So
No, I would not vote against that. I think that
you would not vote.
I think in the cases of life or health of the mother, that is a medical determination. That's
You're saying
something.
that a woman should have a right to have an abortion if her life is at issue, but also if her health is at issue? You would allow